Here on my far left we have Carl Petrakowski from Public Health England. We have Dr. Adrian Davis, who is Professor of Transport at Health from Edinburgh University.
5 minutes.
Can you hear? You can hear. Good. Okay. If you can't, will you do semaphore or something? Jolly good. Sarah Price on my right, who is Executive Lead for Population Health and Commissioning for Manchester Health and Social Care Partnership, and of course Professor Shane Amara. Now, I appreciate there may well be questions that people want to ask very specifically to Shane with regard to his book, and a whole plethora of questions and intriguing thoughts that come from his book. The session as a whole, however, is entitled, Is Walking a Miracle Cure? That's quite a strong statement, really. And the whole point of it is to focus on the role that walking has to play in tackling public health issues. So that's the kind of key part of this session. We've got an hour, so there's plenty of time. I have specifically asked all our panel members that if they want to be provocative or challenging, then to go right ahead and be so. And that's echoed also in the questions that you might want to put. Because bear in mind Norman's caution about nodding dogs. So we emphatically haven't got nodding dogs on the platform here. I'm going to ask for questions in sets of 3. If you could say who you are and where you're from, that would be great. And if you could really focus on that link between investment in walking and public health, that would be great. So, let's see where we go. There are roving mics. We all have mics. Again, if you can't hear, please indicate. So, the gentleman just there, a woman in the middle there, and a hand. I can't see to whom it belongs. Yes, hi. The man there. Okay, so we'll take those 3 first. So if you could say who you are and where you're from, that'd be great.
Mark Strong from Transport Initiatives. Many years ago, I was working in Sustrans, where there was one of the first GP health referrals, and now we're moving on to GP walking referrals. So I'm going to be provocative and say, when I've seen them doing it in where I live, there might be 20 people doing a GP-led walk, and it hasn't. You think those 20 people, how much of an impact does it make? Is making the environment better walking much better than just leading these small groups of a few usually privileged white elderly people going out for a walk, and is that a waste of time?
Thank you very much.
Hi, Susie Morrow, Wandsworth, Living Streets. Is the coronavirus an opportunity for triggering behaviour change towards walking and cycling? Actually as a way to reduce exposure, rather than expecting or possibly having the effect of people moving away from public transport and getting back into cars.
Thank you. A topical question. And the gentleman about halfway down with a pale blue shirt.
Roger Geffen from Cycling UK. I just spotting the graph of increasing life expectancy. Every so often we hear this idea that due to physical inactivity, we may be the first generation where people have lower life expectancy than their parents. Is that a premature fear? Is it a real fear? Is it a fear that could happen? How does this trade-off between increasing life expectancy due to better healthcare, better nutrition, all the rest of it, versus greater inactivity? How is this playing out or going to play out in the future?
Thank you. Okay, so to the panel, you don't have to answer all the questions. In fact, it would be preferable if you didn't. You can pick and mix. We'll ensure that all 3 questions are covered. But I think, so who'd like to start? Sarah.
Can I just pick up on that last one, just because obviously Sir Michael Marmot published his 10-year update on life expectancy last week on Tuesday, and Greater Manchester is a case study within that report. But what he showed is a stalling over the last 10 years, internationally as well as in this country, on improvements in life expectancy. And in fact, we're also seeing decreases in healthy life expectancy, the point at which you become ill, and so you're living with poor quality life due to illness. And I think one of the things about walking is that it's something that everybody can do with support if required, but it's something everything can do. And so linking those two things together is very important. I think that inequality in outcome for people is huge, and I think that's the thing perhaps we haven't talked about that much today, is how do you address those inequalities? How do you make it easier for certain groups within the population to be able to benefit from walking, cycling, etc.
Do you have any thoughts about that?
Well, one of the arguments is that we put all our resources evenly into activity. We don't necessarily target them at those that are the most in need. And one of the things I think we ought to be doing is absolutely disproportionately investing in groups and in areas where people are less able to benefit from walking and cycling.
Carl?
With the Marmot report, and if you haven't seen it, I highly recommend taking a look at it. And I haven't completely digested it either. It was only out last week. But one of the things that the Marmot report is saying, the life expectancy and healthy life expectancy has stalled a bit, although national statistics came out with some other stats, I think a couple of days ago, saying they'd increased. But it's particularly if you're poor and if you're living in a deprived area, and that is the key, because particularly if you're in a deprived area, we know they've got the worst environments, and that means you're breathing in the air pollution, you've got terrible urban environments often that is not conducive to getting out and walking about, and I could go on there, but that is the key, and I think that comes back to why we have to look at where we're putting our money and creating the parks and green spaces in areas that are deprived, and that will help level up. And then we have to make sure that we're supporting people to get out and about as well.
So just to add to what Carl said, I think one of the things that we need to do, partly to answer Mark's question, the first question, is population level interventions. They're the best thing that we can do in public health. So I give the easy example for transport, and we talked about it this morning, is 20 miles an hour if you do it to town or city-wide, because it touches everyone's life then, and we can improve the safety of people who are most exposed. We know that people in poorest communities are more likely to be run over as children and as adults, etc. We need to do other things as well. That means we can still do health walks. We might need to do something about the promotion of health walks and how people enter into that world. But I think a really key thing for us is to do town and city-wide interventions that reach everyone, and then it changes the social norm, because some of these groups they're hard to work with or hard to reach as the category goes. They are influenced, like we all are, birds of a feather flock together. They're influenced by the normative behaviour around them. So if everyone treats cyclists as mad people in working class communities, etc., then you're never going to get anyone to cycle. You've got to change the social norm. So we have to do the macro stuff and some of the micro stuff, which might be the walk groups, but we must change the infrastructure and change the environment, because they are the environmental cues, which Shane was alluding to earlier about our towns and cities. Are they walkable places, or do they discourage walking?
Shane?
Yeah, just to pick up on that, and I think one of the questioners asked about how we design our towns and cities. What we don't typically do, I think, is design them with walkability in mind. And we don't think about charters for walking as being baked into the design fabric of our towns and cities. It's kind of something that comes afterwards. But we can't ask people to always remember that they have to do 12,000 steps a day or 10,000 steps a day. What we have to do is design our towns and cities so that you do it without thinking about it. So just to give a simple example, in the building I work in, to get to the stairs, you have to walk through 3 fire doors. But to use the lift, you just stand in front of the lift and push the button. So the default is there that you should be using the lift rather than using the stairs. And it's a small example, but if you challenge the architect on this, he'll say, oh, aesthetics or some rubbish like this. And what you actually really need to do is to think, well, how is that building designed? Why do we design it in this way? How are people to move in buildings? How are we to move between buildings? And we need to make it easy for people to default to do it on foot or to do it under their own power rather than getting into a car.
And what about the coronavirus challenge, directed particularly for those of you from public health?
I am no expert in coronavirus. I am not medically qualified. I would say go onto the government website and follow the advice there. I think it could either be an opportunity for cycling and walking or a threat because, for example, next week I've got to go down to Bristol and I'm thinking, do I get on a train with lots of people coughing and hacking there, or do I just jump in my car and just drive down there? I could see it go either way. I think maybe some of the messages we need to get out and about, and I'll have a think about this later on and speak to my colleagues, is, get out and about safely, and, we just need to make sure the messages are getting out there. Some of the wider mood music is, I got here last night, I was watching television, and I saw a football team, I was watching the sports, I saw a football team based in Manchester lose a FA Cup tie, and then I was astonished to see an advertisement come up that was telling me to get out and go for a walk, to eat an apple, drink some water. And then I woke up, and then I realized I was having a bad dream, and the certain Manchester team had actually won the football cup. The ads were telling me to get out and get in a fast car with seemingly no traffic, and they was all telling me to drink beer and eat salty food, sugary food, high-fat food. I think that's the mood music that we really have to challenge, and I think that goes to the heart of how we talk, with some of the groups that are not in this room, if I can say, like my kids, who are not here, they just dream of getting in the car and eating the hot, the fast food and things like that.
So particularly thinking from a public health perspective, public health is now part of local government. Local government budgets have been cut by around 50%. So I think everybody in this room would agree in terms of what needs to be done, but in terms of the how.
So, I had experience of working, I'll say a pleasure, to work part-time inside Bristol City Council's transport team for 11 years, which was very enlightening and enabled, I think, Bristol City Council to do things it would never have thought about, because I brought with me an evidence-based approach, and I think in local government, in certain areas, evidence-based approaches are certainly suppressed by the dominant ideological drive of councillors to do what they would like to do. But we were working with local government before the 2011 Act inside, because we had a very innovative director of public health, who was a visionary director, who was a statesman, who saw the opportunity. And so a group of us were embedded into parts of the built environment in Bristol, and we did a lot of work to change those cues to do we walk and cycle by working with urban design teams, with the traffic engineers and all the rest. And I think that sort of integrated approach that we have to have, so that, okay, you could have public health people sitting inside transport departments, but they need to be inside housing departments and all the rest of it, in order to have that wider lens put on it. And that just isn't normal at the moment, and I think that's the approach. Now, I'm sitting partly as a chair of transport and health in Edinburgh, and in Scotland and in Wales, we have health boards. They're in different organisations as well. So it comes far harder again. So we have to do a lot of work to try to overcome those sectorial and siloed approaches that have failed us. So we've got the cities we have today and the thousands of cities we've got today. So I think we need to have new ways of working.
Are there any hands from either of the sides? I want to give you the fair crack of the whip, as it were. There's a woman up there in a sort of rust colour, David there, and there's a hand at the... Is the gentleman with a beard? Yes, at the back. I'll try and get everybody.
Hello, this is the woman in rust, or Gemma from the Ramblers.
Could you stand up? In fact, if people could stand up, that would be really helpful. Thank you.
So I was struck by Professor Amara's talk about ease, accessibility, safety and enjoyment. And my question for the panel is, do we focus enough on enjoyment?
I'll come to you first when we come to it. David?
David Harrison, London Living Street. My question in the first instance to Carl. It does seem that the public health message about obesity, exercise, being about diet in the first place, second sport, recreation and leisure our everyday lives, as most of the panelists say. Is that changing? And secondly, would you like to clarify the statement you made earlier when you were talking about health inequalities, about the importance of parks? It's surely, as Professor O'Mara said, the importance of having an urban environment which is walkable as much as having parks and open space.
Okay, and gentleman with the beard at the back.
Yeah, I'm Rod King. We listened to Professor O'Mara, and it's difficult to comprehend whether in all those millions and millions of years which we've been developing our brains, that we've ever had to deal with anything moving faster than 20 miles an hour. 2 weeks ago at a global road safety conference of ministers, they mandated in a resolution that 30 kilometres per hour or 20 miles an hour should be the maximum speed limit where pedestrians, cyclists and motor vehicles mix. We've had various people supporting 20 mile an hour implementations this morning. Isn't it time that we all now demand, rather than support, that our streets, if we want them to
That's
be
a
healthy,
question, yeah?
have to be 20 miles an hour maximum?
Thank you very much. So, I think the first and bits of the third are very much directed towards you, Shane, and then I'll come to others. Ease and enjoyability.
Ease and enjoyability. Again, you know, when you look through planning documents for towns and cities, you don't see much by way of reference to enjoyment. It's talked about in an economic context, but it's not talked very much about in terms of everyday average person's well-being. And to my mind, again, you know, we're going to all be living in towns and cities, increasingly so over the next 100 years. These kinds of factors need to be designed in right from the get-go to make our towns and cities attractive places to be. And, you know, when you travel to different countries, you see cities that formerly have been terrible and are now actually enjoyable, but you see the reverse as well. I've travelled many times to India, and Bangalore was a city that used to be a beautiful city to walk around. And has been destroyed in the last years because it's so car-bound, and the new metro is not designed for ease of movement of individuals. And I think that's immensely regrettable. You know, you're seeing the same mistakes being made, and then these are baked in for 50 or 100 years, and then you try and unpick them. So I think we need to really start thinking about individuals at the core and our social relationships at the core of our towns and cities. And that in turn will pay great benefits to us all.
And politicians don't talk about that.
Yeah, politicians.
And yet actually the direct lived experience of people is very powerful.
Yeah, that's all true, and Pauls are really good at talking. But if you want to find out if they're serious or not, you have to look at where they're spending money. And your budget instantiates your priority. And if you're spending millions or billions or whatever it happens to be on roads and nothing on transport, on bicycles or walking or whatever, well then you know what the priority is and the words are empty.
And the point raised by the third questioner in terms of human brains from the evolutionary point of view aren't equipped for speed. Your thoughts on that?
That's a really good question actually, to be fair. We are not good runners. We're moderate speed and we can keep it up for reasonable periods of times, but antelopes will outrun us, lions will outrun us and eat us very, very easily. But we are exceptional walkers. And if you look at the kind of natural rhythms that occur in the brain, one in particular known as theta rhythm, it's activated preferentially at about our average walking speed. And this is the one that facilitates information pickup from the environment. Now, if you've all had this experience where you drive for 3 hours on a motorway, you've experienced the whole thing, but you get to your destination, you don't remember any of it. But walk for 3 hours and you will remember a hell of a lot of it. So what we learn on the fly is best facilitated by moving around at the speed that we're designed for.
Interesting. The other questions?
Well, there's a question about green spaces. I think green spaces is part of the answer. Of course, green spaces are intrinsically good for health and well-being, but I completely agree, greening our walkways and our roads have other benefits as well, and they make them pleasant in turn for people to get out and about. I think there was a question around, physical activity has a part in helping people to maintain a healthy weight. And I think that is the message that certainly we've been giving recently. Again, there's a recent publication. Again, if you want any statistics around physical activity and health, there's a publication called Health Matters, Public Health England. You can find it, just came out, and it'll give you all the stats you want around that. I think from a local authority's point of view, though, in terms of, I think it's around, dare I say, taking a whole system approach. And I thought where Andy Burnham was so good today, where he was talking about developing livable neighborhoods, healthy integrated transport systems, and healthy high streets coming together. And that, it's easy for me to say, that is the challenge for local authorities to try to put together. From where I sit, my challenge is to try to work with my colleagues in Department for Transport and with the planning departments so we can try to put out consistent messages where health is prioritized within their planning guidance.
So I would absolutely agree with that, and something that we really benefit from in Greater Manchester is the partnerships that we have, the integration between health, social care and all other aspects of public service. So I sit on the Mayor's Transport Board. We talk about active travel and health benefits from that, in addition to whether or not the trains are on time and platform 13 and 14 and Piccadilly are being redeveloped. You know, it's a whole system look. And the other thing we've been able to do is to include health as an objective within our spatial plan. It's about to go to consultation after the election. Who knows, it may not get through, but it feels like we're fundamentally saying that health is important. And I think really the messages that we get out have to be tuned to the audience. Some really interesting work done maybe 18 months ago now by the Health Foundation with a group called Frameworks, which looked at how people interpret the messages that they hear. So when we say it would be really good to go out and walk, they hear being told and instructed and don't feel obligated to do it. Whereas if you frame it differently, then you can really get that message across. And I think there's something that we all need to learn in public service about how you do that, creating a social movement, making sure people are at the heart of that, perhaps is the way to do it, but doing it in a language that people understand and don't feel threatened by. So it might not be, it's really good for you to go out walking, it's, do you want to get somewhere, how do you get somewhere efficiently, and walking becomes the logical way of doing it.
Can I just mention a bit we've touched on before about prescribing? We talked about social prescribing this morning. That one of the challenges we've got has been that the medical sector has been poor in the training of doctors in terms of physical activity. So in a 5-year training program, people I grew up with who trained as doctors got half a day, if they're lucky, on learning about physical activity. Get much more time learning about the skin as the largest organ in the body and other things, which is understandable. But the amount of time, given what Shane said and what others have said, and I will use the word here, Jerry Morrison told us, the founding father of research on physical activity research, that found the link between physical inactivity and cancer, and heart disease, that doctors have not been trained well in terms of the efficacy and value of physical activity in general, and have been slow to pick up social prescribing as a route to get people to walk. William Burb really started this in the UK at Sonning Common, and that's taken off massively in recent years, and we've got a bit of that now for cycling as well. But we're in catch-up mode, I think, with junior doctors now who have been getting more training on the value of physical activity. Be surprised at people doctors in their 50s and early 60s finishing their years in practice who got very, very little training in physical activity research and understanding that that's what they should be helping to prescribe to people for the physical and the mental well-being benefits.
I got none at all.
Well, there we go. My case example on my right.
Okay, Cynthia, and the lady behind Cynthia, and gentleman just there.
Hello, my name is Devaki. I'm a member of Living Street. Basically, I'm a medical graduate, so I just want to, it's not really a question, I just want to emphasize walking or cycling or any form of activity is very good, mainly because of these 3 steps which I'm going to mention.
Could you speak up a little? Sorry.
Can you hear me?
Really hear.
Yeah, is it okay? When somebody is exercising, all our body cells open up. There are pores created on the surface of the cell which can take in the food, mainly the glucose, and all the cells utilize it. That is why we feel happy. The body feels relaxed and the brain gets more blood supply, because when we are walking or exercising, what happens is all our blood vessels are pliable and they dilate. Due to that vasodilatation, the circulation is improved, the brain gets a lot of nutrients, so it feels relaxed. And also there is this hormone called somatin, proved to secrete when we are exercising or doing yoga, and we feel more relaxed and happy because of that hormone. Apart from that, the main killers called diabetes, high blood pressure and cancer, all of them are, it's clinically evident through so many studies that all are coming under control. I can explain the mechanism, but it will take a lot of time. Sorry,
okay.
But yes, it is. Thank you very much.
Thank you for that. I hope for questions, yeah? Yeah. Gentleman just there.
My name's Robert Hale. I come from a town called Evesham in the middle of Worcestershire. Today has been very city-focused, I feel. And the fact that I come from Evesham is quite important. We've got lots of green space and a very nice park. But I can tell you, Manchester's a modern town with broad streets. It's only been around a couple of 100 years, as opposed to the 1300 years of where I've come from. But we have a horrendous traffic problem. Manchester's got no traffic problem in comparison.
And the question?
It's how you cope with that. And it comes actually to your eye level control. And if you change the control crossings in the middle of Evesham, rather than taking an hour to go through the mile of the town, it would take 2 or 3 hours. How do you cope with different abilities to cross these crossings? I would actually like to see them, control crossings in general, abolished in favour of the zebra crossings we talked about. I would like to see the 2 control crossings on Evesham High Street got rid of and replaced with about 8 or 9 crossings. And I would like to see the Swiss style, which are yellow zebra crossings with Swiss style regulation.
Okay. So you've answered your own question, but we'll ask the panel
Yeah.
their answer.
Do you agree with me?
Okay, lovely. Thank you. And we'll get in a third. The woman just there in the pale blue jumper. Thank you.
Thank you. My name is Eileen Morgan. I won't stand up because I'm sitting in a wheelchair, and so I hope you can see me from where you are. My issue is that the main barrier for me to walking or cycling or doing any form of exercise is the health service. To be able to walk, you usually wear a pair of shoes, and if you have a problem with your feet and your shoes are made through the unorthotic department, there are rules about how many pairs of shoes you're allowed, and you usually are allowed 1 pair for walking in and 1 pair in repair. If you request a pair of shoes to go to the gym or to do any other form of exercise, you're usually refused. And I know this because for the past 8 to 10 years, I've had more than 8 different consultants, doctors, GPs, and so on, all support me in having a pair of gym shoes so that I could exercise. And each time I was refused because I was told I was not exceptional. And you're only allowed an additional pair of shoes if you are exceptional. So the only way I could get the shoes was to find £1,000 to pay for a pair of gym shoes to be made for me through the orthotics department of the National Health. So that was my first barrier. So those shoes are the most precious item I've got, and I don't want to get them wet and I don't want to get them dirty, so I can't go outside in them. I keep them for the gym so that I can go into the gym and use the treadmill. The second point is that equipment, whether it's a mobility scooter or an active wheelchair, is so expensive to have. The chair that I'm sitting in is called a transit chair. It has no suspension and it's very uncomfortable for me. I would like to have a chair with suspension so that I could do something like Nordic walking on wheels. And to be able to do that, you need £6,500 to buy one, and even more money for different types of chairs. So just like you have different shoes for walking, for cycling, for hiking and whatever, people with disabilities also need different types of equipment and different types of shoes. And if the health authority won't support in paying for those items, then you are, putting barriers in our way and making it very difficult.
Thank you for that information. Thank you. I wasn't aware of a lot of that, and I suspect others weren't either, so thank you. Responses? Who'd like to go?
Health service.
It looks like you're volunteers.
Yeah, I'm volunteered. I have to confess I did not know that detail, and certainly something I'll take that. We are looking at wheelchair commissioning at the moment, actually, because we're going to do that across Greater Manchester in order that we can get more consistency in what people have available, but I'll definitely take up that point.
I'll just mention about crossings, the gentleman from Evesham. I mean, I think the point that you're making, which was alluded to by Andy Burnham this morning and also Chris Boardman about different styles of crossing which make it much easier, is probably at the heart of it. You can put it in Manchester, but you can put it in the High Street in Evesham. We're trialling, or will be trialling, a different type of informal crossing with Glasgow City Council soon. So we've had this period with a Belisha Beacon type of world for many, many years, and it's not really fit for purpose. So we have to change it, particularly we have to make it more cost effective, because some of these crossings cost tens of thousands of pounds, and we're in an austerity period, of course, still. So I think we are at a tipping point probably where we are going to see some changes, massively overdue, which hopefully would mean that the pedestrian can actually have a freer environment to move in. There need to be all the other changes that happen, the issue about 20-mile-an-hour speed limits, but many other things that need to go to make civilised streets and high streets, whatever size and scale of the settlement pattern. So it's just one of the many things we must do, but it is a must-do, and we need to roll back the previous things that we were spending our money on, which was really traffic signalled crossings.
Carl?
I'd like to just slightly broaden out, again, the Evesham issue as well. I live in Oxford, and going out to Evesham, I think you would go out to Witney, which is about 10-15 miles away. I can more or less cycle out to Witney pretty safely because there's a separate cycle track. It's fantastic. The fact that from Witney, which is a commuter town, into Oxford has some of the most terrible traffic jams is another story. That's getting people to shift and take a fairly long cycle ride. But that is the only place coming out of Oxford. All the other big towns, basically on a hiding to nothing, because I'm cycling with right on the middle of the road with cars going 50, 60, 70 miles an hour. Absolutely dangerous. So one of the challenges I think we've got is around connectivity between our towns. And I was just looking earlier on, if I wanted to go from here, say, to Stockport, let's say I got on the bus, and then I lived in, Edgeley? Is that, yeah. Could I put my bike on the bus so I could then get over to Edgeley? That's one of my bugbears. Everywhere in the States, you can take a bike, although there aren't bus services, but when you do see a bus, that's right here. In New Jersey, you can put your bike on every bus that comes by. You can't do it here. I don't know if the mayor has the ability to do that or if that's set by national contracts. No one's yet given me a real answer to that. But that's one of the things I'd like to see. So you can get from A to B very easily and then cycle around so it's not dangerous.
And increasingly on trains, you have to book a place on a specific train at a specific time for your bike, which is deeply, deeply irritating.
I think what the Mayor wants to do is, the map that Chris Boardman put up this morning showing connectivity, we just don't have that really in Greater Manchester, but the idea is that you can join journeys up. So you might cycle for part of it, you might take a bus for part of it, and you might take a train or the tram. So I think the idea is not necessarily to mean that you take your bike everywhere you go, but that you can safely store it while you use other modes of transport.
I'm going to see if anyone else. I'm going to look at the side first. Stuart, the woman down at the end there, and a woman right at the back there, in the corner. Yes, you. Yeah, yeah. The whole point is to get the roving mic person to walk lots.
Stuart here. The question is the human brain evolved enough to walk
Could you speak up a bit, Stuart?
Sorry. Is the human brain evolved enough to walk safely with a mobile phone? And if so, is the current fashion of road safety professionals to focus on this issue justified?
Thank you. And the woman there with a grey jumper in the front.
Hi, Susie Andrews. I'm a public health practitioner with Buckinghamshire County Council. So I have just a question mainly for a professor from Public Health England. So in terms of the messages that we want to get out there about walking to our residents, so I know we had the Active 10 campaign a while ago. Is that still the same, or we want to encourage brisk walking? Is it any sort of walking? Have we got any stipulations on the amount that people should do? You know, is there a minimum amount that should do? And also, so that's my question, but also just to mention about the medical practitioners and training in physical activity. If anybody's not come across the Moving Medicine resources, it's a really great online platform, and they're aiming to train virtually medical practitioners in physical activity to be aware of.
Okay. I didn't hear a question in that. Is that fair?
Oh, yeah, the question was how much should we be advising our residents to walk? Is there a minimum?
Okay, thank you very much. And then it's the woman. Oh, you got it. Lovely, excellent. Could you stand up? Thank you.
Sarah, sorry to disappoint you, it's the hair and the shirt, but I am the bloke.
I really apologise. I'm so sorry. I could only see the top of your head.
No, you're not the first person. It's my own issue. Don Naylor from Stockport Council. I'm just wondering, in view of last week's High Court decision about the Heathrow third runway, and kind of an expectation there may be challenges to other large high-carbon infrastructure transport projects. Should we be optimistic about that? Is there going to be more funding freed up to do the small stuff?
Okay. So mobiles, are we equipped, Shane? That's
yes,
one
we are. And in fact, every study we've got shows that people's peripheral vision gets better when they're using a mobile phone, believe it or not. If you ever go to Schiphol Airport, there's a very nice way you can demonstrate this to yourself. They've got lovely wrought iron pillars in the airport, and flanking the pillars are tiles that are slightly different in texture to the tiles around them. And if you watch people, they see the tiles in their peripheral vision and they move around.
Really?
Yeah, it's really, really quite remarkable. And it also sharpens your hearing as well, believe it or not.
Fascinating.
For what are known as oddball stimuli. So you don't hear the ordinary stuff that's going on, but a sudden screech, you will alert very quickly to that. But selfies on the edge of cliffs, that's a bad idea.
All these facts you didn't know. Absolutely fascinating. Heathrow.
Well, so just picking up the Heathrow thing as a heuristic for a larger issue of carbon-intense travel. I'm worried that Shane keeps talking about airports, because I avoid airports, and I think we have to all try and avoid airports. Sorry about having to say that on stage.
We live in an island.
Well,
so do you.
Indeed, but I refuse to travel, for example, out of the European continent, so it's a lifestyle choice I've made. So my point about the airport issue is that it is a test really about climate change and the climate emergency. And in fact, the climate emergency gives us the best chance we have, at least from a public health perspective, but I think from a wider perspective, to be able to do the things we need to do. So coming down from Scotland today, the First Minister says the agenda for 2020 for Scotland is climate change followed by climate change followed by climate change. Now, how that actually plays out in reality with public policy is a separate thing, but the message is clear. We have to have a very, very steep energy descent, and that does unfortunately mean we have to fly a lot less and all those and many, many other things entirely. So I think the airport thing is a signal. Also, Bristol Airport had a refusal of its planning permission recently, and hopefully we will see more. I'm sure that one hasn't finished its discussion, but I think it's a signal that actually there is a big opportunity here for us.
Sarah.
So one of the things we're looking at in Greater Manchester is how you create a population health system. So you move away from individual programmes and look in totality at what you do to improve health outcome. And we looked elsewhere at what people have been able to achieve. For example, in Wales, the Future Generations Act, which is actually an act about sustainability, yes. On the back of that, have been able to really look at what the long-term impact of things are going to be. And the M4 extension was refused on the basis that it wasn't going to be good for future generations of the population of Wales. So those are the sorts of things I think that we can start to use to be able to make the right decisions for the right reasons.
Thank you. Okay. The hand there, the check shirt. And oh, no, but hang on. Hang on. And then the woman behind you with holding up paper, blonde hair and glasses, and at the back. I can't. I have to be careful. I can't. I can see a hand. I don't see the rest. Okay. Yes.
Right. Andrew Hodgson, President of National Federation of the Blind of the UK. 2 points I'd like to pick up with what Shane's been saying. I wonder, are you serious about this business about people being able to navigate with mobile phones? The number of people who almost walk into me because they're using their mobile phone. I can't take that point seriously, I'm afraid. A point that I would like to take more seriously, I'd be interested to know more about the business about the ability of visually impaired people to navigate, because I imagine that would vary according to the cause of the blindness, because if people are born premature and have oxygen damage, that damages the optic nerve, and that can have quite an effect in many cases on the ability to navigate independently.
Thank you. So that's very much one for Shane. Behind you, the glasses? Yes, hi.
Thank you. Lisa Mulherry, I'm a Leeds City Councillor and Cabinet Member for Climate Change, Transport and Sustainable Development in Leeds. I'm really keen to hear what the panel think health professionals' role is in terms of challenging the cultural norms about driving as opposed to walking or cycling. And I'm thinking particularly health visitors and GPs, school nurses. We were talking earlier about encouraging the next generation to get out of the habit of driving. And we know that actually being in a car, being driven to school, you're getting worse air quality than you are walking along the same road. So what advice would you give to health professionals to help us to make that change in terms of cultural norms?
Thank you. And behind you, also with the glasses.
Yes, John Bromwich. I'm a Living Streets member in South London, in Brixton. I live in a 20-mile-an-hour area, and I've also been the victim of a hit-and-run accident in that 20-mile-an-hour area. I also go to the cinema quite a lot, and I see probably 10 or 15 minutes worth of advertisements for cars saying exactly how glamorous they are, how fast they go, how quickly they brake, etc. So I have two related questions. One is there any reason why we shouldn't ban advertising for cars in the same way as we banned advertising for smoking, first of all? And a slightly wider question is, how do we change the culture of driving in this country?
Okay, so a suggestion of some sticks. Okay. Shane,
Yes,
more
so
detail on the visual impaired.
Yes, so I made the point seriously about peripheral vision. That is just a fact. But I think that the issue here is the social norm around the use of mobile phones in crowded spaces rather than the issue to do with the enhancements in peripheral vision. And people need to pay more attention to other people. But, it's not an unreasonable thing to request. And then the issue regarding the type of blindness. So the general feeling or the general theory is that the more experience that you have of the extended spatial world, the better you are at navigating three-dimensional spaces. But if there's extensive compromise to the underlying brain systems that process those spaces, well, then they are going to be compromised. And we see this in conditions like Alzheimer's disease, for example, where the hippocampal formation is damaged and people lose orientation in time and space, even though the visual system may be perfectly intact. So it's a question to do with how the central processing is affected or not by the kind of conditions that were being talked about.
That's helpful. Thank you. And then the question's really around the role of public health professionals in changing cultural norms, particularly with regard to climate change. I think for all of you, really.
Well, I thought I heard that there was partly a question around how do we change, like NHS professionals as well. And I think the long-term NHS plan does begin to address that, and this sets out some way that the NHS should reduce certainly its carbon footprint and look at its transport costs as well. They've made some steps there. I think, where we've already begun to see, like in London and certain other places, we've seen first responders now on bicycles because, not for health reasons, but because it's much quicker for them to get to respond by being on a bike. So we've seen some movement. Trying to get your midwives and health visitors, if I'm to stereotype a class of NHS professional, which will be hard to shift, who are reliant on their cars now, will be a real challenge. And I think it sets out also around work patterns and things like that.
So the question was more about how to make every contact count with the public rather than taking the
Okay. I mean, I think some of the material that Public Health England and NHS England has put out has been directed to professionals. We need to get them in and get them absorbed into continuing professional development, particularly. And in a similar way, just to pick up the public health professionals, I think the work that we've done over the past 5-6 years is to provide a range of evidence briefings and resources, building on work like Shane's done, and trying to translate that for public health professionals so they can begin to implement that. But, as we know in Manchester, we've got public health now sitting in local authorities, sitting with housing, transport, planning colleagues, and ideally influencing their agendas.
So one of the challenges is, practicing what we preach, isn't it? And one of the issues I've got is that a lot of people that work for me come to work by car because it's cheaper. So if you live in Bury, to get the tram in can be £8 something, I think it is, return a day. You can park in the centre of Manchester, as some of you will know, for about £5. So it's cheaper to drive, and we've got to change that, haven't we, if we're going to make a difference. So it's not just about appealing to people's doing the right thing. It's actually making it easier to make the right choice. The work we're doing to try and encourage modal shift, as Chris would call it, is to try to create environments that people really want to walk and cycle in. But you have to have the behaviour change that goes alongside that, don't you? And so some of the work we're doing to try and create that social movement around walking. I'm sitting here holding a Good Stroll's Good for Your Northern Soul kits that are available out there for a campaign that we're starting on the 20th of March to try and help people see that this is the easy choice to make. But that's for people at work as well, and using this information when you're out and about with, as a champion for walking and cycling, whether you're a health visitor or a social worker or someone working in hospital. These are the things that we want people to be able to use to be able to get those messages out there and change behaviour.
There was actually, around 2 months ago, 2 or 3 months ago, there was a special edition of the British Medical Journal that looked very specifically at the role of the NHS within climate change and what a greedy service it is in terms of energy.
5% of our carbon footprint.
5% of our carbon footprint, is it? Yeah. So you might want to look that up. You might find that helpful. Should we ban car advertising? Was a question.
Well, one of the things is, we first start, there's a very good analogy here because of the tobacco thing that many people outside public health even understand well. So cars are the new tobacco. It has been the title of various academic papers, and it's an understanding of the power of the roads lobby, which is an entity out there in all its different guises, from the people that build the roads to the people that service the automotive industry, and it's very, very large, and it's actually got more money than the tobacco lobby had. So, you know, it is enormously challenging for us, but we have to work to change that. You know, it is a David versus Goliath type of activity. But one of the things really is this point about social norms. We have to change the social norms. We have to do this thing about, if you're taking away something from someone's life, you're giving something back better, which is if you're walking more, the things that Shane talked about and we've heard about today in terms of the well-being and the other benefits you get, are things that we need to talk up. And as Simon O'Brien said, we've really got to talk the talk about these things and really promote it. You know, we were designed as hunter-gatherers and all that sort of stuff. We have not outlived that destiny. We've just chosen to drive to Sainsbury's to go shopping now instead. when we could, we should be doing other things and using local shops. So I think there's a big marketing program to be done, and that's about how we together find a resource to do that. And I don't know how Public Health England would want to say anything about that, but it costs a lot of money to do those. You know, we heard earlier this morning that Mars had far more people advertising their brand than the interventions to promote public health, and that's been the case for a long, long time. So I think there needs to be a shift, a bit like Think campaign in road safety. We've had a long, long period now of doing clunk, click and various things so that people understand that this is what you do and what is normative, and we have to do this normative shift from a position where the car is the norm to change that. The fiscal stuff is really important, of course. So what Andy Burnham was saying and Chris was saying this morning is enormously important about making an integrated ticket that doesn't cost an arm and a leg and stop young people, for example, from getting on a bus rather than sharing a car or an Uber. Should we ban car advertising? You nodded, Sharon.
Well, I was actually thinking maybe not ban car advertising, but when you look at cars being advertised, they're always on open urban streets, sweeping along. And the reality is, when our towns and cities are not like that, so maybe we should actually just insist that car advertising be realistic.
In a 2-hour traffic jam.
Yeah.
Okay, we've got 2-3 minutes. If you've spoken before, I'm not going to, because literally it's one, I think. There's two. So the gentleman right at the back and helping there. But you've got, please, really, really crisp, very, very quick question.
My name's
Please stand up.
Yes. Jonathan Fingland, an advocate in Greater Manchester. Just quickly for Carl, we should speak afterwards because the bus cycle carriage thing is a vehicle regs. But my question for the health people primarily, I wish I had an exec member who was here today and who was that enthusiastic to take this health stuff on board when it comes to transport. So,
question.
We've got a great Director of Public Health. How can advocates enable these Directors of Public Health to have more influence within the Council? Any tips about what you've learned and how we can get those people to be more influential?
Thank you very much. Thank you. Quick question, please.
Yeah, Sarah Gayton from the National Federation of the Blind. How can we ensure all this work that's been undertaken is underpinned with accessible design, because a lot of the schemes going in are not accessible, are actually preventing people to walk and have independent lives. So how can we do that, please?
Thank you. Quick fire.
In terms of getting public health more influence in the council, I think you have to really, from experience, you have to really be able to shape your message in a way that appeals to members, essentially. You know, you can't talk about mortality rates and things like that. That doesn't win them over. You've got to think about the issues that they're trying to resolve in their communities and apply what works in terms of public health so that you start to get that momentum amongst the political will.
It's making sure that local public health teams actually understand this strange world of transport planning and spatial planning, because it's a whole new world for us, and likewise, you know, for transport and spatial planners as well. That's what we found. We've made some steps, but I think we need to carry on working on that.
And part of that, I think, having been very close to the cabinet member years ago in Bristol, we've had so many of them going through, is the ability to understand what makes them tick, what they're interested in. So we've got evidence oodling out of our ears in terms of the cost effectiveness of walking, cycling interventions, etc., etc. But it's finding out really what works for them and how you can perhaps show the co-benefits that might fall in another area. So I think you've really got to understand the mindset of the councillors and the leaders inside local government and what it, in their situation is going to win it for them, which could be public approval as well.
And Bristol and Manchester are easy, because in places like Oxfordshire, which are two-tier counties, it's much more difficult to do.
And
just
fittingly, last word.
Yeah, just to address the last question there. You know, people who have particular needs need to be brought into the design process, and the design process needs to be designed around their needs. You know, it's all very well designing streets that are good for me because I'm a healthy person, but somebody who's got particular needs, they need to be in the core of the design process, and they need to be looked after first.
I think that's a very fitting note on which to end. Thank you. So this was about health, public health and walking. I think we've had some splendid, considered responses to all sorts of questions from you all. Can we thank all of our speakers on this panel hugely for their contribution?